Are you keeping up with the world's most urgent health threats? In just the past week, deadly outbreaks have shaken Asia, Africa, and the Americas, reminding us how quickly diseases can cross borders and change lives. From anthrax's return in Thailand to the silent surge of measles in South Korea and a bird flu outbreak that experts warn could spark the next pandemic, this is your essential health bulletin update. First, Thailand is on high alert after reporting its first anthrax death since 1994. A 53-year-old man in Mukdahan province, near the Laos border, died after handling a dead cow, bringing renewed attention to this rare but deadly disease. Anthrax, caused by bacteria Bacillus anthracis in soil, usually infects livestock but can be fatal to humans, causing skin lesions, blisters, and severe swelling. Authorities have confirmed only one death despite rumors of more and are acting fast. Over 1,200 cattle have been vaccinated in the outbreak zone. 638 people at risk, including butchers and those who ate raw beef, are being monitored and given antibiotics. The public is being warned. Avoid eating raw meat, a common dish in the region. This outbreak is a stark reminder. Even ancient diseases can return when vigilance slips. Let's turn our attention to Nigeria, where health officials are fighting on two fronts. Since January, the country has confirmed 832 cases of Lassa fever and MPOX, with 135 deaths so far in 2025. Lassa fever, spread by rodents, and MPOX, a viral infection with smallpox-like symptoms, are both causing concern. The Nigeria Center for Disease Control has activated emergency operations and deployed rapid response teams to hotspot states. Surveillance, treatment, and vaccination strategies are being ramped up. Meanwhile, community outreach and lab capacity are being strengthened to contain the outbreaks. While cases are starting to decline, the risk remains high, especially in regions where these diseases are endemic. Measles, once nearly eradicated in many countries, is on the rise again. South Korea has reported its highest number of cases in 6 years, 52 infections so far in 2025, surpassing last year's total. Most cases were imported by travelers, but local transmission is increasing. This trend isn't isolated. Even Canada's Ontario province has seen over 1,200 cases since October, and Mexico's Chihuahua state has staggering 844 cases. The US is also seeing clusters, mostly among unvaccinated individuals. Health experts warn that vaccine misinformation and declining immunization rates are fueling these outbreaks. The message is clear. Vaccination remains our best defense against measles and other preventable diseases. Perhaps the most concerning development, the rapid spread of H5N1 bird flu across US dairy farms. Since March 2024, over 1,000 dairy herds have been affected, with more than 70 human infections and at least one death. The virus has now jumped from birds to cows, and even to farm workers. But why does this matter? The virus's ability to infect mammals increases the risk of mutations that could enable human-to-human transmission, a scenario that could spark a new pandemic. Experts are urging enhanced surveillance, standardized testing, and vaccination for both animals and farm workers. The CDC stresses that the general public risk is still low, but precautions are essential for those in close contact with infected animals. Global virologists are calling for immediate action, warning that failure to act now could pave the way for another devastating pandemic. Staying informed is your best defense. Outbreaks can happen anywhere, anytime, but with awareness and science, we can respond quickly and save lives. Subscribe to Health Bulletin for your weekly dose of critical updates and share this video to help others stay protected.